Well, ladies and gentlemen, welcome, and a very warm welcome indeed to all of you. I'm Genevieve Jacobs. I'm delighted to have been asked by the Capital Health Network, the University of Canberra, and the Healthcare Consumers Association of the ACT to facilitate today's election forum. It's my first. I think I've got about 6 lined up, so I'll look at this one as an excellent practice run in the lead up to this election. I'd like to welcome everybody, those of you here in the room with us and also those of you joining us via the stream, for a very COVID-safe election forum. And I just wanted to reassure you that all sorts of measures have been taken. Apart from the Zoom aspect and the physical separation, we'll also be wiping down microphones and obviously maintaining the appropriate social distancing, because it wouldn't be the done thing when we're having a health forum to do otherwise, would it? Today we're going to focus on key issues affecting community-based healthcare in Canberra. And of course, there's never been a more pertinent time to do so. We're obviously still in the midst of a pandemic that's changed life for all of us, made us carefully consider our own choices, created uncertainty and fear. But more broadly, healthcare has always been a pressing issue here in the Territory as we grapple with effectively meeting the needs of a rapidly expanding community, and also, of course, that regional demand for healthcare that accompanies our growing importance as the centre of the capital region. Before we begin, I would like to warmly invite Ngunnawal Elder Auntie Ros Brown to kindly give us the welcome to country.
Hello everyone. Firstly, I acknowledge the Ngunnawal people and the United Ngunnawal Elders Council, who are traditional owners of the ACT and region. I also acknowledge other Aboriginal and Torres Strait Islander peoples and non-Indigenous friends present. A special acknowledgement to Minister Rachel Stephen-Smith, Minister Rattenbury, Shadow Minister Dunne, and Genevieve Jacobs. I also acknowledge the University of Canberra, the Capital Health Network, and the Healthcare Consumers Association. It takes courage to do work for the greater good. Elders understand that as leaders, we need to learn how to solve problems, include, not isolate, share knowledge and listen with our hearts, and also speak from our souls. For those who are not aware, Welcome to Country is an ancient Aboriginal protocol that ensures your spirit is protected. It also protects the spirit of the Aboriginal people of whose land you are on. It is the elders who welcome you and pray for safe journey during your time on country. On behalf of the Ngunnawal people, may the spirit of our ancestors embrace you and keep you safe. Welcome to Ngunnawal Country. Thank you.
Thank you so much, Auntie Ros. And I'd like to now warmly welcome our 3 panel members. We have ACT Health Minister Rachel Stephen-Smith, MLA from ACT Labor, Shadow Minister for Health, Vicki Dunne, MLA from the Canberra Liberals. And I do want to acknowledge that Vicki Dunne had her last day in the Assembly this week after many long years of service to the people of Ginninderra and to the people of Canberra. And the Leader of the Greens and current Minister for Mental Health, Shane Rattenbury, MLA. We do appreciate you all coming along to talk about the 4 key issues in this important area of community-based healthcare. And I think this is of really particular significance. Often the things that grab the headlines are things like emergency waiting times or other issues that are picked up by we in the media, whereas of course the interface for most of us with health is very much in the community, in our everyday lives. So we're going to focus around 4 issues: access, integration, prevention, and mental health. But before we get started, I just want to run through how today's forum will go. Firstly, each of our panel members will have the opportunity to give a 5-minute presentation about the position and approach of their party to key issues in community-based healthcare here in Canberra. Following this, each panel member will be asked 1 question per issue, and they'll have 2 minutes to answer each question. There is a bell, so it's just like debating at school. I'm sure I've got a shepherd's crook somewhere back here in which I can haul them off. Finally, we'll go to questions from the floor and also for those watching via the webinar. Now, we do ask that the questions from you are apolitical. They should be about ideas and about problems, not a crack at one side or the other, and they should fit within those 4 themes of access, integration, prevention, and mental health. Because the aim of this panel is a really robust interrogation of the real issues around health. So let's aim for a productive conversation along those lines. The questions from the floor could be questions to all panel members or to one particular panel member, but I'll remind you about all of this when we reach the final question session. And our panel members will then have 2 minutes each to provide a summary. So let's get started, and I'd like to invite the current ACT Health Minister, Rachel Stephen-Smith, MLA, to speak for 5 minutes. Please hold your questions until the final session. I think there, Rachel.
Okay, all right. Thank you very much, Genevieve, and thank you to the Capital Health Network, University of Canberra and Healthcare Consumers Association for organising the community-based healthcare election forum, to Genevieve for the introduction, and most of all to Auntie Ros for that beautiful welcome to country. And I want to also acknowledge the traditional custodians of this land, the Ngunnawal people, and pay my respects to elders past, present and emerging. And of course, whenever we talk about health, it is incumbent on us to remember that health outcomes for Aboriginal and Torres Strait Islander people remains a large gap between those health outcomes and those for the rest of the community, and that it has always got to be at the forefront of our minds. ACT Labor, of course, remains committed to continuously improving the health and wellbeing of Canberrans and across our health system, from community to acute care. We are fortunate here in the ACT. We have the lowest burden of disease in Australia. We have the lowest rates of smoking in Australia. We have some of the highest rates of immunisation in Australia and the highest rates of any jurisdiction for Aboriginal and Torres Strait Islander children and aged 1 and 2 who are fully immunised. We do have a good record on paper, but we know that there is still more to do. We know that there are people in our community who experience poor health outcomes, chronic illness, a complex interaction with our health system, and of course the families and carers who support those people in our community and across our health system. But the achievements that we do have in our system are delivered by a dedicated and health and community workforce across government and across non-government services, integrating, innovating, reworking approaches to improve outcomes for consumers and for carers. This year has been a particularly challenging year for all of us. COVID-19 has truly tested our people, our systems, and our society. And this couldn't be truer for the most vulnerable people in our community. And it's further demonstrated the importance of our community sector partners who are closest to many of these consumers and their families and carers. One of the challenges with health, of course, is that there are at least a dozen priorities at any one time. Wait times, Aboriginal and Torres Strait Islander health outcomes, a more efficient system that uses taxpayers' money as effectively as possible, workplace culture and safety, better collaboration with GPs, cutting-edge research and access to clinical trials, better integration with New South Wales for the patients who come to the ACT for treatment and for Canberrans who need to travel interstate, digital health. I'm sure that you can name many others. When I first came into the portfolio just over a year ago, my predecessor, Megan Fitzharris, had just identified the work on paediatric clinical services or child and adolescent health services and the first 1,000 days. I was thrilled to be coming into the portfolio with that announced focus on the first 1,000 days of life. As Minister for Children, Youth and Families, I'd been driving an early support agenda, and bringing those two portfolios together was a really important opportunity and something that I have valued working with the community sector on. That project, unfortunately, was put on pause in February, but has got a report back to the community, and that will be a high priority for me if Labor is re-elected to continue that work. But when I became Health Minister, I set out 3 other priorities in my early meetings with the Directorate and with Canberra Health Services. We must do better in supporting people with chronic illness and complex conditions in the community. We must make our health services across all 3 public hospitals and the community sector accessible and inclusive for people with disability. Having delivered the Disability Justice Strategy as Minister for Disability, I absolutely knew we needed to do the same thing in our health services, bring everyone together, identify the barriers and address them. And we must rebuild and strengthen our relationships with the community sector. The Non-Government Organisation or NGO Leadership Forum established last year started to drive greater integration, understanding, collaboration and co-development between government and our non-government sector. We recognise the diversity of our population and the expertise and specialisation that our community sector holds. This year, the ACT Health Directorate is investing over $50 million in recurrent funding into the sector, a sector that provides specialised alcohol and drug support that delivers against our goals under the Drug Strategy Action Plan, like innovative non-residential rehabilitation service delivered by Carolika, a community sector that provides sexual and reproductive health services and drives delivery through the STI BBV Health Advisory Committee, our community sector partners in CASP, and recently we provided further support for some of our specialised providers, Companion House, Junction Healthcare and Directions to deliver innovative outreach through a new mobile van partnership with Capital Health Network. Partnership is key here. If re-elected, I will continue to focus on finalising the territory-wide health services plan in partnership with our consumers, our carers and the community sector. ACT Labor knows that prevention is better than treatment and treatment closer to home is better than treatment in hospital. That's why we've rolled out walk-in centres and continue to strengthen our community health centres, and that's why we'll continue to work in partnership with the community to deliver on these goals. Thank you. I assume the bell means 1 minute.
Thank you, Minister. And I now ask the Leader of the Greens and the current Minister for Mental Health, Shane Rattenbury MLA, to speak for 5 minutes.
We're just discussing whether the bell represents 30 seconds or a minute.
Oh, okay.
Okay.
Can you give us a warning?
Yeah.
Yeah.
We figured we'd sort out the ground rules.
I just assumed it was a warning.
Thank you for the indulgence.
So I would now ask the Leader of the Greens and current Minister for Mental Health, Shane Rattenbury, to speak for 5 minutes with a warning bell at 4 minutes.
Yeah. We love ground rules, yeah.
Exactly. Thanks, Genevieve, and good afternoon, everyone. It's a real pleasure to join you here and to have people in person, but also to the people online. Like Rachel, I thank the organisers for the event and also thank you, Arnie Roz, for that welcome. It's always great to have you join us. As Genevieve touched on in her opening remarks, 2020, of course, has been an extraordinary year. And what I think it's really put a focus on is what really matters in our community, but also what works for people. And through all of the systems and the responses we've had to make, it's really underlined what's important. And I think that is something that we are focusing on as we're putting our work together for this election campaign. But it's also given us a lot of optimism that rapid change can be possible. And things that have seemed really hard to do have suddenly happened on many occasions. And from where I've sat as a minister, that's been quite exciting because so often it's hard to get things moving. And 2020 has shown us that we can actually do things quite quickly and quite innovatively. It's also underlined really clearly 3 things that I wanted to focus on today in terms of what we think matters from a community health perspective: the social determinants of health, primary health care and preventative health care. The social determinants of health are, for me, really fundamental, and across the portfolio as a whole, which is other areas like justice and corrections, these matters really come through very strongly, including in the mental health space. Things such as housing, the way we have diversionary practices in our justice system, issues of substance abuse, these sort of other factors, and the way people live their lives, their income base, their financial security, and their housing security, all of these things are quite fundamental to health. And so I think when we're talking about having a healthy community, we cannot ignore these factors. And in then talking about community-based healthcare, how do those other factors get drawn in? Primary healthcare, I think, speaks for itself. And in a period in which people have been uncertain of whether they want to approach healthcare services, having it at a local level and people they trust, people they know, I think has been particularly underlined as well. And of course, prevention has been probably gone to the back burner a little bit this year as we've focused on the immediate threat right in front of us. But we cannot lose sight of the fundamental importance of long-term preventative work so that we're not simply in a crisis phase of healthcare all the time. For me, in my role as the Minister for Mental Health, I think we've really demonstrated this in some very practical ways, this emphasis on community care, whether it's been the fact that the ACT continues to be the jurisdiction in Australia that puts the most money into community organisations as a proportion of our mental health spend. And we've continued to embody that. For example, when we announced our mental health funding package for COVID, we of course boosted government services, but we actually put more money into the community providers because we knew they were at the front line and they were the organisations that people trusted and were reaching out to. But also our projects around supported accommodation for long-term mental health consumers, where we know there are some people who will simply need that long-term care and they need somewhere safe and secure to live, and that maximises their independence, gives them safety and security, but is there as a safety net, not just putting them into a government house, but putting them in a place where there is that safety net around them of healthcare so that they can be, when they're about to escalate or they're having difficulties, that can be identified. Through to the new services we rolled out, PACER, the Adolescent Mental Outreach Service, and the HEART model, all of these are about getting people out of acute settings, treating them in places where they feel most comfortable, where they're most likely to have a better experience than in some sort of acute or inpatient environment. I think these demonstrate the sort of values that I've sought to bring to the portfolio, and that very much sit in the Greens' approach to how we want to deal with health policy across the board. The experience of e-health during this year has been instructive. The feedback I've had from a range of service providers has been about the fact that for some people it's been fabulous, for others they're not so keen on it, and it demonstrates to us that we need to set our health services up in a way that actually deals with people in a place they're comfortable. You know, for some people, e-health is going to be the way of the future, or those telehealth consultations, sorry. For some people, though, they're going to want to come back to seeing face-to-face where that's possible, and I think that underlies how we need to do it. So across our policy areas, you'll see us focus particularly on these social determinants of health. It's why we've announced we want to build 1,000 new community and social housing properties over the next 4 years, because we know that's fundamental to people's health. And we also want to put in place long-term agreements for community health partners, 5+ year contracts, so that people have got that ability to invest in staff, invest in infrastructure, and therefore build the strength of our community sector in particular. Thank you very much.
Thank you, Minister. And I'd now like to invite the Shadow Minister for Health, Vicki Dunne, MLA, to speak for 5 minutes with a warning bell at 4 minutes.
Thanks, Genevieve. Yeah. Thank you very much to the organisers and for Genevieve for your steering of the forum, and to Auntie Ros for her welcome to country. It'll come as no surprise that I will have a slightly different view from Rachel and Shane about how our health system is working. And I tend to take the view that Rachel, with all the best will in the world, is saying we're working on insert name of something here. But in fact, Rachel and her predecessors have had 19 years to be working on, and I think that there are things that are pressing problems that will not be addressed without a new sense of urgency. And I'm glad that Shane spoke about that. That it is the case that in this year we've been able to do things and ramp things up and address things in a very quick way. You know, the COVID pop-up facility, thank the Lord we've never had to use it. But to be able to sort of turn around a facility like that in the ridiculously short period of time shows that we actually have the wit and the ingenuity to do things in a much better paced way than we have in the past. I know that there's always a problem of governance, but the thing that always strikes me, even though I talk about governance a lot, is that we don't have a sense of urgency, and things take forever through the cabinet process and people going away and thinking about it. But when you're confronted with urgency, it is instructive that we can work in a much more responsive way. And I hope that some of the lessons we take out of COVID is just that when you have, and how do we take it from a impending, almost existential threat to the things which are, for many of us, existential threats every day. If you have chronic disease, that is an existential threat. I look at a lot of these things through my experience of a mother of two now grown, generally responsible adults. Can't say as much for the 22-year-old as the 39-year-old, but generally responsible adults who have cystic fibrosis, a very severe life-limiting disease. And I can empathise with people who come through my door because in many ways I've experienced what they experience in the community, trying to get attention for their loved one, the person that they care for, whether it be with a chronic disease, whether it be with mental health issues. And I think that when we look at the topics that we're talking about access and integration and prevention, but mainly in relation to access and integration. I think we've got a long way to go. And I know that we're talking about community health, but if the public health system at the large scale is not providing the access that we need, if there are long wait lists, we've talked this week about the paediatric wait lists. If we've got long wait lists like that, firstly, it doesn't give people hope. Firstly, it means that people are getting sicker waiting for services, and we shouldn't be in the situation in a place like Canberra where people are getting sicker on the wait list. And unless we have real access, effective access, we're not going to address those other issues, and it's going to be an increasing burden on community organisations to fill the gaps. And I think that there isn't enough connection between the community organisations and how their members navigate into the acute part of the system and then out again. Because almost all of us will be representing people who at some stage or another need acute access. And when your hospital, as I keep being told, is running at above 90% occupancy, it's very hard to ensure that you have the appropriate access when you need it. And the other thing that I really want to concentrate on is the lack of staff across the board, all sorts of callings. And I think it's just, we've got into the habit of saying, oh, it's always been like this. It's been difficult to recruit insert name of specialty here. And I think that we have to have a more enlightened approach and a more activated approach rather than saying it's always been like that.
Thank you so much. So we now move to the next section of the forum where we have one specific question about each of those four key areas of access, integration, prevention and mental health. And each panel member will have the opportunity to answer each of these questions, but in a space of just 2 minutes. And a slight variation to the timing. In this case, the short bell will ring at 90 seconds and a long bell will ring after 2 minutes. Thank you, Ros, for punctilious timekeeping. And I will also share the order of the answers around. The first question is about access. We'll ask Minister Rattenbury MLA, followed by Shadow Minister Dunne MLA, and then Minister Stephen Smith. So just a reminder again, 2 minutes, warning bell at 90 seconds. I'd like to invite the President of the Healthcare Consumers Association of the ACT, Alan Thomas, to ask the question about access. So now have we got the roving, we do have the roving mic, so we'll just zoom that up to you. Thanks, Alan. If you...
Okay, so thank you, Genevieve. Many consumers wait longer than the clinically recommended times to access outpatient clinics. What are your plans to improve this? And particularly, how will you work with GPs and community-based services, including NGOs, to improve the situation and support consumers to get the care they need?
think one of the first issues is we do need to work on workforce, and Vicki's made this point. We do struggle to bring enough people to Canberra. We need to therefore work closely with our local universities and training organisations, because I think the staff we're most likely to keep or to have in Canberra are those who've grown up here and who feel connected to this community. I think that's a really important start from perhaps the supply side, if you like to describe it that way. I would also say that ensuring that we have a strong focus on preventative health is another part of it. Again, Vicki spoke of the chronic conditions, and where we can certainly seek to intervene earlier, we take the pressure off those waiting lists. And so it's always hard to make that investment in the preventative work, because there's the acute end always demanding more, and it's a beast that is always needing to be fed. But we have to make those deliberate decisions along the way that we are going to provide some greater emphasis into the preventative space. And finally, your point about GPs is a good one, in that they are the place that people go first. I think GPs and pharmacies between them really are that initial point of contact, and making sure that they have access to good connections through government as well. Again, I will tend to defer back to my mental health thinking, because I've done a lot of my thinking through that filter, but for GPs, they're not mental health experts, but with the right support behind them, be it the ability to call and seek specialist advice, can mean that they can actually deal with much more up front if they're given the appropriate support behind them to deal with those circumstances.
Vicki Dunne, to you next.
Thank you. Thanks, Alan. And I think I'll start where Shane has left off. And I think that the role of GPs is underappreciated. And I don't think that in the ACT, the relationship between GPs and government is as seamless as it could be. GPs are utterly vital. And I think that people who have a good relationship with their GP tend to have better health. I'm actually in that sort of weird moment, because I've had the same GP for, I kid you not, 42 years, and he retired last year. And I knew it was going to happen, but to actually sort of find someone who sort of fills that gap for you, and not just for you, but for your whole family often, so that they understand where you're coming from, is very important. And we have to remember that for the most part, GPs are small businessmen as well, and that their practice has to be financially viable. And I think that for a lot of the time we push that off and say, well, that's a Commonwealth responsibility, but in a sense it's a community responsibility. It's a community need, so we have to do something about it. I would like to have a situation where GPs have better contact into the hospital and into the outpatient clinics, so that when they are referring someone, they are being referred and getting treated in the clinically acceptable time, which is not happening. But I think that addressing some of that is facilities and workforce for those clinics. And I think that there is a lot of work that we have to do as a community to make Canberra a more attractive place for people to come and stay. Also to have people who come in fly in, fly out, extra special. I don't mean that in a pejorative way, but for people who are super specialist and we don't have the caseload for everybody, then we have to fly them in.
Mr. Stephen-Smith.
Thank you very much, Alan, and I think I agree basically with everything that Shane and Vicki have said in terms of outpatient wait lists specifically. One of the things that Canberra Health Services has been doing is really doing a methodical audit, I guess, of the outpatient wait list to understand who's on it, who's already been seen somewhere else in the private system and hasn't taken themselves off the wait list, so that we can really focus on the people who actually need the care. There are people on our wait lists from Sydney, from Melbourne, who can actually get care closer to home that'll be better for them and better for our health service. So that's one thing we need to do. But the other thing is the better integration with general practitioners and supporting GPs to appropriately refer, and to refer to one another when that's an option. We know that GPs have subspecialties, but they don't have the pathways to refer to one another across the system when that might be actually a better option. So the work that Capital Health Network's doing with GP pathways is another part of that big picture. And then how do we ensure that we're getting new people into outpatients appointments rather than outpatients seeing the same people when in fact they could be referred into being supported by an allied health worker and then having a telehealth appointment with their specialist when they need it. So it is about, access is also about integration across the system, about making sure that everyone is playing the right role and the patient is really seeing the right person at the right time in the right place for their needs. And if we can get that interaction between GPs, allied health in the community, telehealth supports, then all of that working together, along with better management of our outpatient wait lists, which CHS is working on, that's when we're going to see those things come down, as well as all the things that Shane and Vicki have talked about.
Thank you, Minister. The second question is indeed about integration, and this time we'll start with Shadow Minister Dunne within that 2-second framework. I'd like to invite the Chair of the Capital Health Network, Lyndall Thorburn, to ask the question about integration.
Thank you very much, and thank you for the comments so far. So Capital Health Network is one of 31 PHNs that are funded federally. And we're particularly interested in how each of you see the future ACT government working with us to improve integration and indeed improve care between hospital and community-based health services, as Minister Smith said, about consumers receiving the right care, the right place and the right time. Thanks.
Thanks. Thank you, Lyndall. I think that in a way, the community-based health services appreciate the needs of their client group better than anyone else. And I'll go back to my cystic fibrosis, and I'll acknowledge Heidi in a former life. My cystic fibrosis experience is that the work that the association has done has helped create a better model of care for patients in the ACT to ensure that, for the most part, for an increasing number of patients don't go interstate when they don't need to. And that over my 39 years of involvement with cystic fibrosis, to see how that has developed through cooperation and through beating on the door on many occasions from the association, has created a much better model of care, and along with everything else that has happened in the cystic fibrosis world, Ocambi and Kaleidoco and stuff like that, making the lives of people and families with cystic fibrosis unimaginably easier than it was 40 years ago. And that's I think what we need to be doing is replicating that in all sorts of associations, because if you're an association which is a specialty disease in a way, you actually know what the community needs, and you need a seat at the table in your particular area. But also there are links into other parts of the health system, and it comes from, I really do believe there is a very important role for community health organisations in advocating, having a seat at the table, and having a real insight into individual sectoral needs.
And Mr.
Good timing, Vicki.
I'm sorry,
Yeah,
Rachel.
getting there.
Oh, me?
Sorry, actually, Rachel, it's you. Sorry about that.
Oh, okay, and I'm sorry, I have actually forgotten what the nub of the question was about integration.
How to work with the PHN.
Oh, okay, sorry, yep, nope, I've got it now. Thank you, Shane. So obviously I touched in the last response to the first question about some of the work that we're doing with Capital Health Network around integrating with GPs and patient and those GP pathways. But I think I want to give a shout out to healthcare consumers again, and we obviously contributed $500,000 in funding for the Community Health Literacy Project through which created the Health Literacy Network, which was launched just earlier this week. And that in this year will start off with webinars on practical health literacy topics, developing a network of peers in different organisations to better understand and talk about health literacy, and providing online resources for health and community workers and consumers. And I think that work in both supporting health literacy for consumers themselves, for their families, but also for primary care practitioners, for people across our health system to better communicate with their patients about the journey that they are on, particularly for people with chronic illness and complex health needs. Having a general practitioner, and I agree with Vicki, GPs, if you've got a good GP that you have trust in and who knows you, your health outcomes and your capacity to navigate that journey is going to be so different to someone who is not able to access a general practitioner for whatever reason. And we know that, you know, obviously, bulk billing rates are not high in the ACT. For those who don't already have a GP, it's hard to find one, and particularly if you are vulnerable and have complex needs. So that is something we need. We have been working, and I mentioned the funding for directions and others, that we need to work more with access to general practice for those most vulnerable in our community. And I think also patient care navigation, connecting the opportunity to connect people up. There is no doubt that patient care navigation is going to be a critical part of our health system into the future, and I think everyone will agree on that as well.
I have a very pragmatic approach to this, is that we must be integrated because we sit in the same geographic area, commissioning services or funding them or providing them. And we cannot afford to duplicate. There's simply not enough resources in the health system to be tripping over each other. But we also must ensure that we don't have gaps between the services. And so I think we've always been very fortunate in the ACT that there has been a positive relationship between the PHN and the ACT government, but goodwill is not enough, because otherwise you will end up stumbling over each other. And so we are actually on Monday about to launch the Regional Mental Health Plan, which has been a partnership between the CHN and the ACT government and a range of community stakeholders. And I'm really pleased that this piece of work has finally come to fruition, a few months ahead of schedule even, despite COVID. And we actually have sat down and worked out what are the needs in our community, what are the priorities, what are the pathways we need to build, and who's going to provide them. And I think this gives us a really clear map now of how to go forward, because we know what we need to do. Each organisation can fulfil the part that it needs to play, and I think that will be a case study of how to do it in other areas. And so I think that is an example of how we need to do it. And I think the why is absolutely clear, because there is not enough resources to not do it. And frankly, our community needs us to operate in this way. They should not have to navigate through the system. You know, I often say this about even within the ACT government. It's not Canberra residents' job to know how the ACT government work. It's our job for them to turn up. And we'll worry about the internals. They just need to know that they're going to get the right experience. And it needs to be the same between the PHN and the ACT government service provision.
Okay, our third question is about prevention, and in this case I'll begin first with Minister Stephen Smith, and I'd like to invite Julie Blackburn, who is the clinical liaison nurse at the University of Canberra and a director of the Capital Health Network, to ask that question.
Thanks. Thanks for your time this afternoon. So this year has shown us that good investment in prevention will have a major impact on the overall health of our society and reduce money spent on hospitalisation and long-term health issues. So recognising the escalation of the issues associated with family violence, mental health, drug and alcohol related problems, what further strides will be taken by our future ACT government to not only address these issues, but also ensure that the health professionals working in primary health and the community sector delivering the services will have appropriate resourcing to mitigate that.
Thank you. Thank you very much. That's a great question, and it's a very big question, I want to start, I did mention the First 1,000 Days project in my introduction, and that I think is absolutely critical. As Minister for Children, Youth and Families, as well as Minister for Aboriginal and Torres Strait Islander Affairs, and now as Minister for Health, that getting the best start in life, supporting women before they become pregnant women and families, and children in the earliest days of their lives, to get the best start in life is absolutely fundamental to delivering good outcomes across the life, across a person's life. And hearing parents' voices, patients' voices, putting children and parents at the centre of policy development and delivering peer-led and peer-directed services, I think has all got to be an important part of that. But you're absolutely right, it's got to be also in engaging all of those providers across the system, and that's part of the challenge in the first 1,000 days. Services are so fragmented, and we don't have a great map, or haven't had a great map of what services actually exist. And as Shane said, people are expected to navigate the system themselves, and providers within the system don't necessarily know who to refer to. So that for me will be a really big focus. And the other area I just want to touch on in relation to early intervention is for young people with mental health and drug and alcohol issues. So I see in my job a lot of young people with comorbid mental health, drug and alcohol, childhood trauma impacts, and they don't have a home across services. So one of the things we've committed to, and we talked about in the Assembly last week, was a better integrated service across mental health, drug and alcohol, and trauma-informed services across for all age groups, but particularly focused on young people where those mental health conditions are emerging and those drug and alcohol issues are starting.
Thanks, Julie. For me, this comes back to the topic I spoke about in my opening remarks around the social determinants of health, and I think that goes to the heart of your question, and sitting in that for me is the notions of health literacy. In a modern, busy, complex world, people I don't think have those basic understandings of what it means to be healthy, and so I think we need to put more emphasis in that space. As someone who's spent certainly my adult life and a lot of my childhood life sort of involved in sport, for example, the skills and understanding that brings you is sadly lost on many in our community. But I think in terms of that social determinants, a lot of that also takes place outside the health system, and you spoke of family violence. For me, it is those sort of examples. The Women's Legal Centre now runs a great service, who temporarily escapes me, but where they provide lawyers who are in the hospitals.
Health Justice Partnership.
Thank you, Health Justice Partnership, where the lawyers are, when someone comes in seeking help in the hospital, they'll talk to them about the family violence that's possibly sitting behind their presentation. The government has put a lot of emphasis on justice reinvestment. And I've worked on this a lot through my justice and corrections portfolios, but the idea that if we spend the money up front on a range of things, people will not end up in jail ultimately. That's sort of the end point of the justice reinvestment model. The idea that we're better off spending money on the prevention rather than building bigger jails all the time. And a great example of that is the program Yarrabee Bamir that we run in partnership with Woonunga Nimmicha, where they're taking a family-centric approach, and whilst the end goal is to ensure that Aboriginal and Torres Strait Islander people don't end up in jail, at the front end, people are seeing their GP more often, the children in the family are attending school more frequently, the contact with care and protection has dropped, and so through that investment, I think we've done a lot to provide a preventative health framework that will really determine significant social outcomes for those families.
Vicki Dunne.
Thanks, and thanks for the question. And is this an outbreak of love or something?
We're all retiring, Vicki, so it gets easier.
But the thing is that Shane has touched on some of the things that I'm really passionate about, and some of the things that we see that in other places they've done better. I think that there's a lot that we can learn from some of the work that's been done in New Zealand about family intervention, intervening even before people are pregnant, making sure that women who are pregnant are safe, that they have the skills. So, children don't come with an instruction book, and some of us aren't socialised in child rearing, and often people are by themselves. And if we don't have those interventions where they're needed, and leave people alone if they're not needed, we do actually run the risk of creating increasing problems along the way. And it's not just in those social areas as well, but there needs to be the right sort of intervention in a whole range of health areas. And one of the things that's been occupying my mind recently is the long list of people with orthopaedic problems who spend a long time on wait lists. I am going to say something that Rachel's not going to like. We don't have enough hydrotherapy. We also don't have enough prehabilitation, in a sense, fitness programs for people who are waiting for hip and joint replacements and things like that. All of that integrated to ensure that when people have their operation, they're weller than they currently are, that their recovery is better, and sometimes they may not actually need the surgical intervention because there might be another intervention. And that is all about how you integrate, whether you integrate a service, you integrate an orthopaedic service, integrate your child and health and mental health. All of these things require integration. It means that you have to talk.
Thank you. Our final question in this part of the forum is about mental health, and it will go first to Minister Rattenbury. I'd like to ask Emma Coy to ask this one. She's a first-year Master of Clinical Psychology student here at the University of Canberra.
Thank you. Are there plans to bridge gaps in youth mental health services, especially for disadvantaged children less than 12 years of age? At present, there are limited services for children with complex presentations whose families cannot afford private psychology services, which even with Medicare rebates can be very expensive due to gap fees, but also do not meet the threshold for service a child and adolescent mental health service. Considering the possible further and prolonged financial impacts on disadvantaged families in the ACT region due to COVID-19, are there plans to extend or develop new early intervention services for these clients to make treatment more accessible?
I think in that age group, particularly under 12, it's really come to the fore in the last few years that there has been a significant gap there. And we have started to invest in some programs that do look at that. So through Men's Link, we started a program for younger men, and through MEACT, Heidi sitting at the front here, some of the work that's rolling out in the schools, it's an area that needs more work. We don't want children that younger age ending up in an inpatient environment. I think that would be a poor outcome for them. And the preventative programs, for me, are really where the focus needs to be. The schools, having been an education minister for a little while, there's a lot of work being done at school level. And that's providing, I think, that those sort of fundamental skills that should set people up for having more resilience and more coping skills for some of the challenges that will confront them. But for those that then need more help, we need to have a more rapid response. The Office of Mental Health and Wellbeing is doing a project on how do we tackle that missing middle. And this really goes to your question about CAMS. At the moment, the feedback we get is, we probably do some of the preventative stuff quite well at schools, and if someone's really bad, they can get into the service, but what about the bunch in the middle? And I don't think anybody's worked that out, to be honest, yet. Headspace provides some of that, but there's limits to their capability, and they're certainly not looking at children under 12. So we've got a piece of work to do in that space, and I've been very pleased that, again, MEACT has helped us with this, is that in the work the office has done, they've actually engaged a lot of young people to ask them, what does that look like and how do we roll it out? There's a lot more online services out there, but I'm not convinced they're the right answer for everybody. And it goes back to my earlier observation around telehealth, is that for some people that will be right, but for others we need to look at a different range of services.
Vicki Dunne.
I think that there is a missing middle. I think what we've seen with schools is that schools are, in a sense, revealing the extent of the problem. And I think that we're yet not geared up to addressing the problem. And we do have, again, it's a workforce shortage. There is a chronic shortage of workforce, especially for child and adolescent mental health. And I think that we have to grow that workforce ourselves to some extent. So people like you. And we need to keep you. And that means that we have to build the right environment. And in a sense, you have to build that environment. As someone who is coming into this fresh and new, you should be having a say in what it is that keeps you here and keeps you engaged with this community. And because I think that we haven't plumbed the depth of the problem. I think that we know, and I think that Shane and I would agree, that it is a big problem, but I don't think we've actually tested the extent of that problem, and I think that is an ongoing conversation.
Rachel Stevens-Smith.
Yeah, no, it's absolutely. I remember the first time as Minister for Children, Youth and Families, I went to visit a child and family centre, and I was told about the increase in anxiety presentation for children who are that age, up to 8 years old. We're starting to see anxiety appear in younger and younger children, but we also have an opportunity to address that in young children, to support parents to do that through things like circles of security and parenting programs that work with the whole family as soon as that starts to present. We need to understand that better. Anxiety, the growth in the presentation of anxiety in young people is enormous. The stats will tell us for young women, but also for young men, and Shane's talked about the expansion of Men's Link and the need to bring that down to a younger age group. We need to better understand the impact of social media on our young people and their mental health. And we also need to provide safe and supportive places for our diverse young people. So we know that LGBTIQ plus young people are more likely to experience mental ill health, are more likely to self-harm, are more likely to try suicide, and that is why we are so committed to our Safe and Supportive Schools program and to expanding and working with organisations like Agenda and supporting groups in our community that will in turn support our LGBTIQ young people who are at risk of really poor mental health outcomes. The other thing I think we need to do is supplement those face-to-face services, and the Office for Mental Health and Wellbeing is working on an online portal to enable young people to manage their own health and wellbeing. Now that might not work for under 12s, or it might work for their parents and families to help them better connect and navigate services, to document their experience, to understand what triggers are for mental health episodes. All of those things need to come together, I think. Thanks.
Okay, that brings us to the end of that particular section of our forum, and we'll now move on to general questions from the floor. Your question could be for all panel members or perhaps just for one. So for those of you who are in the room, I ask you to raise your hand if you have a question, and we'll bring a microphone over to you. We do also, of course, have many people watching this election forum live via Zoom. So if that is you, please type your question in. Regardless of whether you're in the room or watching via Zoom, please also just introduce yourself before asking or typing your question. We do have two moderators for the Zoom questions, Darlene Cox, who's the Executive Director of the Healthcare Consumers Association of the ACT, and Megan Carl, the CEO of the Capital Health Network. So I'd ask you again to make your questions apolitical and to ensure that they fit within the four key themes of today: access, integration, prevention, or mental health. And your question may be for one or for all the members of the panel. And I think our first question comes from Auntie Ros.
As you know, Rachel and other ministers, I'm co-chair of the Ngunnawal Bush Healing Farm, and the beds have been empty for years. There's 8 beds out there. Participants are being picked up in the morning and taken back into Canberra in the afternoon, but we feel that that our participants that are approved to go out there should be able to stay out at the farm. It's no good having 8 empty rooms, and we're wondering if elected, would you give assurance to the Ngunnawal people and other Aboriginal and Torres Strait Islander people, will you keep funding this important healing place for our youth and other members of our community that need healing? And will you open the beds and keep funding the Ngunnawal Bush Healing Farm?
I think we'd perhaps like to hear from all of the panel on this one. And Minister Stephen Smith, obviously this has been a long-running issue and one that's of deep, deep importance to the United Ngunnawal Elders Council, to the Ngunnawal people, and it goes indeed to the purpose of the Bush Healing Farm. Is this going to be resolved at any time soon?
Yeah, I want to start by thanking Auntie Ros and Uncle Fred for their participation on the Ngunnawal Bush Healing Farm Advisory Board, which is working through, and UNIC and the board are working through the healing framework now with the Healing Foundation, and I expect that work must be nearly complete to develop that program for a residential program of care. So absolutely, we are committed to delivering that, and I thank you really very much, Ros, for your work in designing ongoing and the living web that I think you two have talked so much about over time, of how that will be part of the continuation of, or the continuum of care for Aboriginal and Torres Strait Islander people in their drug rehabilitation journey, not as first-line rehabilitation, but as healing, connecting to country, connecting to culture, and coming out the other side of that a more whole person and able to, reintegrate with the community and family.
Dunne, would there be an equal commitment from the Liberal Party were you to win government? Again, this has been a long-running issue and one that's very crucial to dealing with issues within the local Indigenous community.
Genevieve, this has been a shameful saga, that this has gone on for so long, and then when the Bush Healing Farm finally opened its doors, it was not what anyone envisaged it would be. And it shows extraordinary disrespect for a community in need that we have waited so long and received so little from what was such a promising thing. James Milligan and I have spoken about this at length, and we have had discussions, and James in particular has had discussions with the elders groups and with Gwinanga, and we are utterly committed to ensuring that the Bush Healing Farm works the way it was envisaged, that it has to be residential. I think part of the problem is that there are planning problems associated with this, and even though it's a beautiful building, and perhaps we built it in the wrong place, but it's there, and we've spent $10, $12 million of taxpayers' money on it. We should be getting benefit from it, and I think that the delays and the false dawns have been shameful.
Shane Rattenbury, the function of the Bush Healing Farm goes to everything we've discussed here about community health, because it addresses the entire spectrum of wellbeing. What's the Greens' commitment, and what action can you take on ensuring the delivery of the Bush Healing Farm in its originally intended form?
Yeah, look, the Bush Healing Farm is desperately underutilised. It's a tremendous site. I went out about 3 years ago now with a whole lot of actually justice agency people, and we were looking to see whether we could actually nab it off the health directorate so we could use it, because we felt it was being underutilised. And whilst that's not been possible, I pick up on Vicki's point. There have been issues around the planning rules. I have this philosophy that we are the government, we should be able to fix that because we write the rules.
Planning system.
I know, you would have thought so. But Ros, to go to your specific question, yes, we are committed to continuing to fund it, and we are committed to making sure that it is better used than it is currently. It is an amazing site. For people who have not been there, once you get up the back of the block, there's all these very old grass trees and the like. There is tremendous opportunity on this site to do a lot, and I think I'd like to get some people involved in it who've got that entrepreneurial spirit to make more use of what is out there.
Okay, do we have a question from the Zoom? Megan, perhaps if you'd like to ask it?
Microphone.
We need a
microphone. Sorry.
We've had a question from Dr. Melanie Dorrington, who's a GP, who says, as a GP, I see people living with domestic abuse, either whilst living in the same household or after leaving the household. This has major health implications for the survivors, whether they are adults or children. The Domestic Violence Prevention Council has been doing some great work, which the ACT government has and continues to implement. We need to secure funding and support for the important work of the council. So the question is, what policies does your party have to prevent and respond to violence towards women and children?
Again, I'll give each member of our panel the opportunity to respond to that. Vicki Dunne, on that question of domestic violence funding.
I think that we're on everyone's on a unity ticket in regard to the extent to which we need to fund a range of services. I had an absolutely appalling constituency issue just this week of a woman who has escaped violence with her children and is in search of trauma counselling for her children, and has been waiting months to get access to psychological services for her children. and it has actually discovered that it's easier for her to get access to psychological services for herself and adapt them for her children than to have her children seen. So there is clearly a shortfall in funding, there is a shortfall in expertise, and while we have made great steps, while those sorts of issues abound, and if we fail to provide appropriate housing and safety for people leaving domestic violence and appropriate financial independence, the risk of people sort of returning to a violent situation is quite terrible. And having people re-abused is something that that concerns me greatly. There must be, not so much for, I think we've actually got to the stage where we're identifying it, but it's providing the services that keep people safe when they've recognised where they are is absolutely the paramount next step.
Shane Rattenbury, surely this goes exactly to the gap you spoke of a few moments ago, because people who are in these situations are often, beyond simply being at risk, they're into the process of being damaged by the situations in which they've found themselves and therefore at further risk of things becoming really catastrophic. What's the Greens' response?
I appreciate Vicki's comment about this being a unity ticket in the sense that Australians have been made very aware of the depth of the family violence problem in this country, and I don't think anybody in politics considers that this is not a problem. It's about both putting the adequate resources in and also being bold enough to try new things in the space, because we have to crack open an issue that is a deep cultural problem in this country. I think there are a range of responses that cut right across the service sectors. Our plans in the housing and homelessness space, for example, are to not only build 1,000 new community and social housing properties over the next 4 years, which will be an economic stimulus, but also provide that opportunity, but also to better fund a range of the homelessness services, because we know that they've seen increasing demand and a range of women, particularly with children, find themselves, frankly, sleeping in their cars because they don't know where else to go once a family violence situation arises. We're very conscious of the cohort of older women who are finding themselves increasingly homeless, often linked to family violence matters. On the other side of the spectrum, we also need to think about how we deal with the perpetrators of family violence more effectively in the justice system. That, for me, includes things such as providing bail accommodation, so that when the police do intervene, there is actually somewhere for the magistrate to send the perpetrator that is not back to the family home or to jail, but actually places where, and we're talking about operating in partnership with various men's groups around town, so that there's an intervention at that point in time. So I think there's a series of responses we need to make across the spectrum. Even this term, we've changed the legislation so that restorative justice can now be applied to family violence matters. That will not be right for every case, but it's about looking at the fact that no two family violence cases are ever the same, and so we need a whole set of responses through the system.
And Rachel Stephen-Smith, the government's approach is a whole of system. Does it envisage the spectrum through which this occurs and the impact on wellbeing at every level for victims?
Yeah, so as both Vicki and Shane have said, obviously everyone is really conscious that this is an issue that we haven't tackled in the past and haven't tackled well in the past. And the government obviously introduced the Family Safety Levy in 2016. One of the things that funded was the Innovation Hub work led by Joe Wood, and that delivered the Health Justice Partnership, among other things that Shane was talking about earlier, putting legal services into hospitals, into child and family centres, into places that women are going to be and to feel safe to access services. Shane also touched on the perpetrator programs, and I think what we have heard, what the Innovation Hub heard, what we've heard now from children through the work of the Child and Young People Commissioner Jodie Griffiths-Cook, with young people hearing their experiences of domestic and family violence, is for both women and for children, for partners and for children, they don't necessarily want the person to leave, they want the violence to end. And that being able to take the perpetrator out of the home and work with them if they are willing to do that work in order to return safely to their family is absolutely critical. a couple of years ago, I was privileged to go on a study tour to the UK and talk to the people in Leeds about some of the restorative work that they are doing in their system. And one of those programs is an outreach of, with an opportunity for family group conferencing to women who are, or people whose partners who experience domestic violence when there's a report to police. There's an outreach to those people in a safe way. Do they want to start a journey of having that conversation within their family about how they're going to end the violence and keep themselves and their families safe? So yes, there's more work to do. I think we would all agree, and it's very complex and it's multifaceted, but it's absolutely critical.
Okay, let's move on to a question from the floor, and put your hand up, and I'll go to you first, and then we'll come to you after that. Thank you.
Thank you for the opportunity. I'm here representing Palliative Care ACT. Palliative care in the Territory is an area of growing demand, including for respite and other services. We are seeking to address some of this need with the development of a new non-clinical respite facility for people with a life-limiting illness, their families and carers, and are seeking support for some operational costs. My question to you all is, what additional investment strategies do each of the parties have for palliative care in the Territory?
Rattenbury, I'll start with you.
Yes, the honest answer is we have not finished developing our policies in this space just yet, but certainly we've had the discussion about the palliative care model that's being proposed, and I think this is a great example of partnership between non-government organisations and the government. It is entirely appropriate for government to invest in those sort of models, both in supporting the organisations that are trying to do it, but also in the fact that it's a very cost-effective way to do it. It draws out the relative strengths and capabilities of both sides, and for government it is a very sensible investment because it leverages all of that community input. So we are very keen to sort of work more in this space. I think part of our thing is that there's some areas we don't feel we have enough depth in our policy, and that's where we're also very keen to work with community organisations because we know that there's a lot of knowledge out there. And I guess one of our philosophies has always been in our role in the Assembly is to try and bring the community perspectives into the Parliament and make sure that they are being given a voice.
Rachel Stephen-Smith, I'll go to you. Noting that we were both actually this morning at the launch of the expansion of Clare Holland House, but also noting that, as per your question, that kind of inpatient palliative care is not the full extent of the need within this community. So how does the government respond to that broader question?
Yeah, thanks, Genevieve. And as you say, we were at the sod turning for the expansion of Clare Holland House this morning, and I want to recognise the volunteers from Palliative Care ACT who do such amazing work, not only in Clare Holland, but right across our health system and in the community. And it is absolutely clear that the vast majority of people would prefer to die at home, surrounded by their friends in a familiar place. And the project that you've briefed us on and we've talked about, which obviously I can't make an election commitment in relation to right here and now, but is a very thoughtful response to the support that people and their families and carers need to be able to achieve that goal of dying at home, dignity, security, surrounded by the people they love in a familiar environment. So that is certainly something that we are looking at very closely. The other thing that we have clearly heard from Healthcare Consumers Association and others is the need to improve palliative care services within Canberra Hospital in particular. So that is another thing that we are looking very closely at, that we've worked with healthcare, we'll talk to healthcare consumers about, but it is right across the system, and we're obviously drawing on the recommendations of the end-of-life care report as well.
Dunne, to you?
Well, I hope so. There's a lot of work went into those. Look, I am actually, and I expressed this yesterday, I am quite disappointed that it's more than, we're into the second budget cycle since the End-of-Life Committee reported and the government hasn't really taken up those recommendations. And I'm quite disappointed in that because I think that there was some outstanding recommendations. In relation to Palliative Care ACT's hub, like the rest of them, I'm not making policy announcements today, but I am hopeful that when that announcement is made, you may find some pleasing watch this space, because it is something that I have been quite passionate about. That I think that we we aren't good enough at palliative care. And I think that a lot of the recommendations that came out of the inquiry into end of life pointed the way for us to be more responsive, and whether that's more nurses in aged care, the aged care environment, so that people whose home is an aged care facility, that they die in their home, that for our loved ones who express a wish to die at home, that is more likely to be achieved, but also that if they do express a wish to be able to go to Clare Holland House, that it's there and available. And I think that from my experience dealing with the end of life, the most difficult thing was the evidence that we heard about how terrible palliative care is in the hospital. I was ashamed to listen to it, and I think that we have a long way to go.
Let's go to another question from the Zoom, if we can. Take the microphone down there, and then I'll come to you.
Thanks, everyone. So Darlene Cox from Healthcare Consumers. A question from my colleagues in the disability sector, and it's about the importance of equitable access to healthcare for people with disabilities and good quality care for them. Would you support and commit to working together with people with disabilities, their families and carers, and stakeholders to developing a disability health strategy?
What a very interesting question. Rachel Stephen-Smith?
Yes, absolutely. As I said, one of the first things that I've said to both the Health Directorate and Canberra Health Services, and Canberra Health Services is currently working on a disability action plan. As both Darlene and Lisa would be aware, there was an application for some support through NDIS to develop, for Canberra Health Services to develop its Disability Inclusion Action Plan, which unfortunately was not successful, but they have continued that work. What they have done to date is to pull together everything they have already heard from people with disability through their complaints processes, through previous consultation processes, so that we're not starting from scratch. Again, this is what we did with the Disability Justice Strategy. We didn't want to go and tell people, tell us what your experience was, because people have already told us what their experience is. So we need to start from where they are at and what they have already told us. And that the next stage is to go out and share that with people and say, okay, now what are we going to do about it? But absolutely, that will be an absolute priority for me if I'm re-elected and I have the opportunity to be Health Minister. A disability health strategy right across our system, fundamental priority for me.
Vicki Dunne, that does seem like an idea that's got some substance to it. What's your response from the Liberals?
Short answer, yes. And I could leave it at that, but I think that one of the things that's become really obvious to me, I've been on the select committee into the COVID-19 pandemic response, or something like that, and the clear message that came out of the disability sector was the inequality of access, and also the fear that because you were disabled, you might be receiving less care, or you might be triaged out of, if COVID had struck Australia like it had struck Italy or Spain, would you be triaged out of ICU? Would you be triaged away from ventilators because of your disability? And I think that there was a very strong call, and there were very strong recommendations out of the COVID committee that everyone turning up for service should be treated equally. But sometimes that's really very difficult. When you consider that people with disabilities often have underlying health problems, but sometimes they're less likely to visit the doctor because, as it was put to me on one occasion, the examination bed is inaccessible. There is so much at the really basics that we just haven't got right. It is understandable why people with a disability are afraid in these circumstances.
And Shane Rattenbury, as we've just heard, perhaps that's been particularly pointed up by the present circumstances and the very close to the bone questions about things like triage, the value of life and so on and so forth. Do you agree that there's a distinct need for a disability health approach?
I do, and the work that's already underway, I think, has shone a spotlight on some of the gaps that are there at the moment and the need to be clear in this space. Again, with my mental health hat on, it's the crossovers has been highlighted very clearly in that preliminary work. It has pointed out the fact that our services don't necessarily accommodate the needs that exist at the moment, and that there is a clear need to adapt those services. For example, it's come up a particular question around autism and mental health, and how does that work together? They're the sort of questions that are floating around, and so there is clearly a need for this work to be done.
I think we've got time for perhaps just one more question. To return to my we had the lead up here, so to return to my radio days, we'll crash the news headlines if we don't do it like this. So I apologise to all of those of you who don't get a chance to ask questions, but go ahead.
So Lisa Kelly, CEO at Carers ACT. I don't think we can talk about community-based healthcare without talking about family carers. They facilitate access, they're the navigators, they're the arms that hold mental health. They were the unsung heroes in flattening the curve of COVID, and we haven't fully acknowledged that and recognised that. My question today, though, is around prevention. We know that family carers have some of the highest rates of chronic health conditions, of mental health conditions themselves, are becoming increasingly the highest consumer of health services. So my question is, what are we going to do about improving the lives of carers in order to continue in their role and not have lifelong health impacts from doing so?
Dunne, I'll start with you, because carers, of course, in so many ways bear the burden of the consequences of multiple health issues. What's your response?
First of all, I think that carers need to be put into a position where they don't have to tell their story over and over again. And from my limited and blessed experience, that is one of the things which is just such a burden, that, how many times do you have to describe, when did you first discover that this was a problem, and is it an ongoing problem? Yes, it is, and it's demeaning and it's demoralising and it's just a burden when you're looking for services. And as with almost everything that we do in government, we spend our time trying to make people account for the money that we spend on their behalf and the like. But it also makes beggars out of people. I remember speaking with a lady once who said, every 3 months I have to go and make the same application for continence aids. My child is not getting any better. Why do I have to do this? And instead of sort of saying, here's a bucket of money to spend on continence aids, acquit it once a year, because that issue is not going to change for you. So a lot of it is to treat people, because the burdens of their life are great already, so let's, as a community, lighten the burdens that we can.
That picks up exactly where I was going to start, which is the pressure that sits there on carers that is constant and multifaceted. And in terms of getting into your specific question, Lisa, around, well, how do we improve their health and well-being? I think a lot of it goes to making it easier for them to simply provide the support they do and to ease that burden. I see it very clearly on particularly ageing carers who have that, frankly, heartfelt fear of what happens to their, usually adult child, when they pass. And you can see the fear in the eyes, and it is gut-wrenching. And so, for me, at the very practical levels, that's why we started things like supported accommodation, so that carers can be there thinking there is a path for my child. It's a strange word to use in the context, but there is a path for my child when I'm no longer here to care for them. So that is a part of it. I think the other part of it is thinking about how do we enable carers to have the time and the space to think about themselves. And whether that is meaning that when they need to go for a service, there is a respite option available to them and those sort of things, so they actually do the self-care that they tend not to do because they're so focused on the person they have to care for. So that's quite a broad answer, but I think the question is quite a broad one in that sense, and it is about understanding the nature of that burden and what we can do to lift it where possible. The other observation I would make is I think there's some real work to be done on privacy legislation and privacy rules. And this comes up very much in the mental health space where, we let somebody leave an inpatient facility and they go back to their carer, but because they're an adult, there's a limit on what we can tell the carer about what's just happened to them while they've been in the inpatient facility. There's good reasons for that and for the privacy rules, but I think the settings are not right when it comes to supporting carers and the job they do.
And Rachel Stephen-Smith, finally to you, because of course at the core of this question is the fact that the community health system would fall apart without carers.
Yeah,
Yeah.
Absolutely. And carers would fall apart without Carers ACT. So thank you to Lisa and her team and the work that they do. Carers are, of course, a priority group identified under the Healthy Canberra ACT Preventive Health Plan, recognising that they have specific needs in relation to preventive health care and support. But we also need the data to back that up, to understand exactly what's happening for carers, and that has to be a priority. And I know that, Lisa, you're very driven by data and evidence. And we need to listen to carers, and we've demonstrated that the value in doing that in the development of their Caring for Carers strategy and action plan, and in this space as well, we need to be listening to carers about what it is that they need. So I agree with everything that Vicki and Shane have said about some of those things, and the work that was done to develop the Palliative Care Hub is an example of thoughtful consideration of what carers and families need in order to keep doing that very difficult, very important work. And I think then just to go to Shane's point about privacy and access to information, the rollout of the digital health record, I think we need to absolutely make sure that that meets the needs of carers as well as patients, that they are part of the process of testing the digital health record and getting good access to information and being able to provide information. And what we so often hear, to Vicki's point, the frustration of carers and the anxiety around having to be the holder of all of that information for the person that they care for. Digital health record should help with that, but it needs to be done in a way that works for carers.
We've had a fantastically wide spread of questions, and I want to thank everyone and to say I'm very sorry for those of you who didn't get a chance to ask your questions. We've touched on everything from the Bush Healing Farm to disability, health policy, the role of carers, domestic violence, equitable access, and all very much focused on ideas and problems that happen here in this community. So that's been a really useful conversation. I'm now going to invite each panel member to provide a 2-minute summary. Once again, there'll be a warning bell at 90 seconds, but I'll start with the Health Minister, Rachel Stephen-Smith.
Oh, goodness, Genevieve, I'd forgotten all about the summary. Look, I just want to finish by thanking everyone who's here today, everyone who's here on Zoom for your participation. It is actually by people participating, people providing feedback, people pushing for a better health system is what delivers a better health system. And my commitment, if I have the opportunity to be Health Minister again or to be Minister in a re-elected Bar Labor government, is that I will continue to listen and I will continue to advocate for consumers and carers, and I will continue to work to build that stronger, deeper relationship across the non-government and community sector and with our general practitioners and our other primary care providers, so that we genuinely do have an integrated health system that focuses on prevention, focuses on changing systems so that we can change lives for the better. Thank you.
Shane Rattenbury.
Thank you. It is great to come to an event like this because there's so much expertise in a room like this. People have their particular areas of focus in a way that ministers don't necessarily get to get down to some of that detail. And so what I can say as the Greens is we have a real commitment to listening to those community voices, to getting out and talking to people and trying to bring that expertise and that articulation of the need into the Parliament. I think that for ourselves, entering into the ministry and taking on a portfolio like mental health, we have been able to demonstrate that, given the opportunity, we have got now a proven track record of trying to get to the front of the curve, to operationalise that philosophy of wanting to invest up front, of to be preventative, of the focus we've always had on community provision of mental health and treating people in the place they feel most comfortable, which is generally not in an acute setting. That is a commitment we have going forward, whether it's working with the PHN or with community sector organisations or funding community sector organisations. We see all of those parts of the health system as being fundamental to getting a good health system here in Canberra. The elections tend to be a lot about the promises for big hospitals and shiny new facilities, but actually so much of the work is done at the front line of community service provision, and that is certainly where we want to see a strong emphasis going forward, and the dollars need to sort of meet that philosophical commitment in our view.
Okay, Vicki Dunne.
Thank you. And when I look around this room, the number of people in this room who've been through my doors in the last 4 years that I've been the Shadow Minister for Health, and I want to pay tribute to you for helping me on my learning journey. I'm not going to be here after the election, but I think that the relationship that I've built up with people in the community sector will stand a co-Liberal government in good stead for working with the community, and we're hardwired for that. You know, we don't come from a command and control point of view. We believe that you know, the best decision makers are the people closest to where the decision needs to be made, and therefore we are extraordinarily supportive of community health organisations, and when we announce our policies, I'm sure that you will see that in it. Yes, we do need to build big shiny things, and we should have built them a long time ago, and that is part of the process. We need those. We need the health infrastructure and we need the health workforce, and I think that one of the things that I am most passionate about is ensuring that in subsequent years that the health workforce is better respected, better treated, working in a better environment, and that it's easier for us to keep people here, or it's easy for us to attract people who want to come and you know, visit once a month or once a fortnight, so that we do have great health services here for the people who need it in their homes.
And that actually brings our event to an end. And as I've listened to all the answers, I'm sure you've thought, as I have, about what a thoughtful, considered and well-informed approach we've had from each of our three panellists. Now, as a journalist, both in my days with the ABC and now as the group editor for the Riot Act, I think many people are unaware that if we set aside the competitiveness of an election campaign, what actually goes on behind the scenes at the Assembly is often very cooperative. It's collaborative, it's well-informed, it's thoughtful. There are differences in policies and differences in approach, but we are blessed in many ways by the people whom we elect to public office and who serve us as a community here in Canberra. Thank you all for your willingness to answer questions about community-based healthcare. Thanks very much to our audience here in the room and on Zoom for joining us too. Today's event has been filmed and it will be available on the YouTube channel of the Capital Health Network. Please join me in thanking our panellists, and good afternoon to you all.
Thanks.